The doctor is in today. Our geriatrician expert is Dr. Chandini Sharma, and today we welcome her. Welcome, Dr. Sharma.
Thank you so much.
Yeah, you know, you're an expert when it comes to the topics of constipation and diarrhea, especially in seniors.
Yeah.
And, you know, we know that seniors start to see these issues. Is it because those organs start to function differently as we age?
Beautifully said, beautifully said. Yeah, so when like we say, other organs are sagging or lagging, so the bowel also starts aging. However, you know, that aging bowel actually doesn't start aging only after the age of 65, like all of a sudden it's older. Our bowel habits kind of are determined when we are a kid. One day we had a gentleman in the rehab who told me that he had the first surgery for his constipation when he was age 3.
Wow.
So he just wasn't toilet trained properly. So if constipation, now when I ask patients, do you have constipation? They're like, no. In their mind, they're saying, well, I've had a BM in the last 3-4 days. That is constipation. It's defined as if you feel that you're not completely evacuating your bowel, hard stool, or, of course, stool incontinence. Now, you'll say, well, wait a minute. How is stool incontinence related to constipation? So I usually have a graph that I draw out for the seniors. The intestine is a long organ from the mouth to the rectum and anus. But if there's hard stool backed up in the colon, then the body has to say after a while, like, hey, get rid of this food, gotta get rid of this food. And it's usually liquid food in the upper intestines, and that comes out gushing as diarrhea. So when you ask the senior, like, hey, bowel habit, they're like, well, I've got diarrhea nowadays. But when you ask, how was it before? For weeks, months, there was constipation. Then 2-3 months later, there's a blast of liquid stool, which is incontinent, which means they can't really control or say, or get that notice to go to the bathroom. And then body has got rid of that excess. They're fine, seemingly. They'll keep on having that constipation, mild constipation, incompletely evacuated bowel, and then 3-4 months later, they'll have that big blast again for a day or 2 or more. And then slowly those few months gaps starts becoming lesser, and then they have few days of constipation and then few days of diarrhea. And of course, constipation, they are not bothered, they're not worried. But for the diarrhea, because it comes at inopportune moments, they take more pills to not go to the bathroom, worsening the underlying condition. And some people have actually found surgery to then relieve that constipation. So it's a very common, about 1/3 of the seniors are going through this as we speak today, but also very easy to fix.
Sure. Dr. Sharma, we thank you for your time. We're running out of time today, but go quickly, if people have questions for you or would like to learn more, where can they go?
Usually they just send their messages here and then I get them.
Oh, perfect.
Yeah.
There you go.
Thank you.
Thank you, Dr. Sharma, for your time today.
Thank you. God bless you.